Out of 5,000.
Okay, I'd like to call the Health and Human Services Committee meeting to order.
I'm sorry.
And I guess we'll start with the pledge. Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have a quorum in the room. Heidi, Aileen, myself, Lydia, and Brian is on remote. Christina and Mike Didio have been excused. We have, well, before we start, I'd like to get a motion to approve the minutes of May 11th. I'll move it.
Second, Nightingale.
Okay, all in favor?
Aye.
Great. You'll see we have one appointment on the agenda tonight, Elizabeth Signorelli from Cayuga. She's being recommended to serve on the Persons with Developmental Disabilities Subcommittee. I get a motion for her appointment. We have to do that?
I don't think we have to.
We don't have to do it? No, okay, because it'll be on the ledge meeting?
Yep.
All right, great. Then that name will come forward at the end of the month. We have 9 resolutions tonight, two from the Health Department, 1 from the Department of Social Services, 3 from Mental Health, and 3 from Office for the Aging. If you'd like, we can start with the resolutions, and then, if there's any questions about the information that the department heads have put forward on their report, we could ask them. So Kathleen, do you want to start with your 2 resolutions? Thinking we could review them, HH1 and HH2. Kathleen could discuss them, and then we'll get a motion.
Glad to, thanks. The first request, we had a part-time peer lactation counselor in our WIC program who resigned for other opportunities, and the state requests that we try to fill these, and so we would like to have permission to fill this. It's 100% funded through the WIC program. And the second resolution I have is a request to fill a full-time early intervention service coordinator position due to a resignation. And we have them in the budget. Sorry.
Move to bundle 1 and 2.
Yep.
Second, Nightingale.
Okay, all in favor?
Aye.
Any more questions? All right, great. You have
A little report out. So I was away. Deanna put together a nice report with a lot of information here. I think it's great, certainly, to see the bike rodeo, the National Bike Month, and Moravia really had a great turnout, which you don't necessarily expect that for more rural schools. So that's really fantastic. There's different events that are planned. We've been going out to talk about immunizations and other programs at kindergarten registrations. I think the information on public communication that we shared is just good for people to know what we do, how we do it, when we do it. If anybody reviewed that email. A lot of seasonal work that's going on, right? Getting out a lot more information about harmful algal blooms as they're coming up, all the summertime injury prevention and safety aspects, the early intervention nights and the preschool nights at Play Space that we are coordinating, where we have a therapist or a teacher attend and then invite parents in for those age groups, and the children of those age groups have been going very, very well. The WIC Farmers Market nutrition coupons are in. Breastfeeding classes are going well. Certainly, a lot of talk about the weather the last few days and the smoke in the air. So that's kept us a little busier than typical with phone calls and information. I have not been in touch with the hospital. I don't know whether there's been any uptick in respiratory aggravation that has had to go to the hospital, but I can touch base with them tomorrow. I've been in Albany the last couple of days, and 2 of the things we really were celebrating as health departments. It's not through the final hurdle yet, but legislation to edit Article 36 requirements, which is a licensed home care service agency, and legislation to edit Article 28, the Diagnostic and Treatment Center clinic regulations for local health departments, municipalities, has gone through both houses and is awaiting to be signed by the governor. And that's really going to lift some of the paperwork and administrative burden for things that are typically done under what we call Article 6, the classic public health state aid reimbursable work we do. So that's a that's a really beneficial thing. We've been trying for years with the Article 28 and more recently with Article 36, and we're really pleased that they've gone through both houses and should be approved. So,
I mean, hospitals, think of that as an Article 28. You had to meet similar standards to that, which is kind
is
of
crazy considering our very limited scope of work.
I just had one question. Did you guys reach out to families particularly that might be on waiting lists, or is that how?
We did.
Mhm.
So we asked our service coordinators not only to speak to their families, and it was shared on websites for anybody. You don't have to be engaged
Yeah.
in early intervention or pre-K, and very specifically reached out to some of the families, or all of them. I really don't know if some or all of them on the wait list for services, because that's how it's something to provide, right? And something to show parents how they can engage with their children and assist them in some of the skills.
Yeah, just a comment. I wanted to thank Kathleen and certainly Deanna for the last few days with this health hazard thing. Deanna's been sending out releases and we really appreciate that. I know you were away and she's been helping me out with the law enforcement torch run, which was run today because Deanna said it was okay. So. we
Deanna
really
did not say it was okay.
Well, it was helpful.
Deanna sent the information so they can make the decision themselves. We were very careful
That's what
about
they
that.
told us because
Yes.
of the information she sent.
Yeah.
So thank her for us.
I will.
Thank you.
Thanks.
I do want to thank you for a couple of important messages. One was the information regarding the air quality, and the other, and I was looking for it so that I could actually read it, was we provided some additional cleaning, and do you know what I'm talking about?
Maybe a healthy neighborhoods visit?
Yes, thank you. And would you mind talking a little bit more about that?
Sure. So Healthy Neighborhoods is one of the grant funded programs that we have. And it's about, the focus is on injury prevention, clean indoor air, like radon, asthma, to try and provide education and items as appropriate to help reduce triggers to air quality issues in a home. It's limited where we serve in the county right now is limited to certain neighborhoods based on their housing age. So anyone within the city of Auburn or in Port Byron, Mentz, Montezuma is eligible to participate in this program. And it's where you can call and ask us to come by. We canvass neighborhoods. I know you're familiar with it. And you go in and you help do an assessment for someone's home. It's completely voluntary. And if you could use some more smoke detectors, or you need a new carbon monoxide tester, or maybe you have toddlers and you should have maybe a guard to help keep the oven door shut. So, toddler child doesn't keep opening the oven. Pillow covers for asthmatics, to help keep the dust mites at bay a little bit more. We give you information, but we also are able to give you products to get you started and really demonstrate how they're utilized. It's somewhat similar to our lead poisoning prevention program also, where we are able to give families who engage with us some products to do some very basic, those reminders to wipe those windowsills and mop the floor again, that because dust is just so easily, right? It gets on the child's hands and then they put their hands in their mouth. But we also went to, I think, the town clerk and
The school.
and the schools.
Yes.
And the libraries recently too, for a healthy neighborhood. So we're definitely, we appreciate the promotion of the program because we think it's great and we have a lot to be able to offer. It's a great cooperation also with the fire departments within the areas that we serve as well, because they also help reinforce the messaging and accompany us when they're able to.
I think it was a very friendly and gracious outreach. So thank you for that.
I'm glad that it was a good experience.
Thank you. Thanks. Your one resolution, what happened?
What happened?
Yeah.
It's an easy one, I think. Sorry.
Go ahead, HH3.
Yep, HH3, we're looking to fill 2 caseworker positions that we have due to resignations in our adult protective services unit area.
2 out of how many?
2 out of 5. Yeah. So we've had, we've had a lot of loss in that unit for some reason. I mean, we've had one person went to the state, A person actually went to Brenda's health department in OFA, and someone else has just decided that they're gonna try to go back to school for a master's degree and wants to pursue that, that avenue. So we're looking to fill budgeted positions, 62% reimbursement on those positions.
Can I get a motion for HH3?
Move it, Lydia.
Second, Heidi.
Any further questions about that?
Christine, are these caseworker vacancies eligible for the program that allows us to,
Oh, you're thinking of help.
yep,
No,
no,
caseworkers are not eligible for help because we do continuous recruitment through civil service. So anyone that's interested in applying for a caseworker job can go into civil service and get a test scheduled within days usually.
Seems funny though, because the other position is exempt from the test, but the continuous recruitment makes it ineligible.
Yeah, because we have a continuous
Right,
program.
yes.
We haven't had a test where there's been a wait list, get a test, and then get the results. So.
Okay, have a first and a second, all in favor?
Aye.
I,
Great. Yes. Anything you want to add to your report other
No.
than our homeless is down for some reason?
Almost is
Well,
down
No
probably.
code blue.
You're right. Some reason is probably due to the weather being better. We have had some success with finding permanent housing for some folks, so that's helped as well. So we've seen the number drop from, our high was over 160, between 160 and 170 with the individuals and families tallied together, down to around 120 right now. So that's a good, we're moving in the right direction. I'll take that reprieve right now.
Any other questions for
I mean,
Dave?
just another comment, another thank you. I want to thank you and Jen for attending the meeting we had probably 2 weeks ago regarding asylum seekers. Thank you for your input. It made a lot to my decision, but I thank you very much.
Thank you. You're welcome.
Thank you.
Good.
Okay. Yeah, thank you.
Thank you, Kristen. All right. Let's see, let's get through HH4 right now is the creation of a temporary leave bank for a full-time mental health employee. Can I get a motion for creating a leave bank? Second,
Nightingale, second.
okay, any questions about that? All right, great, all in favor?
I,
And then HH5 is the information you've been talking about, trying to meet the needs of the jail. And-
Yeah, so we currently provide one full-time social worker at the jail to cover the entire jail for mental health needs, which we all know there's a rising need for that. So we've been talking about it over time and, we've been talking about what we can do together through the, with the sheriff as well as myself. And this is sort of the plan that we came up with, is to create a part-time position that's temporary to kind of look at it and see, hey, how much work has this person been able to do? Is there still a need for additional work or time? So it's really kind of evaluating that over the course of the 6 months. And he has money in his budget to pay for this position, but it would be overseen by our department as we kind of oversee all of the mental health in the jail currently.
Great. Can I get, did we get a motion for this?
Nightingale, move it.
Second? No, second. Okay. And the part of the resolution is really just to make the adjustments in those budgets to move the money from his budget to your budget.
Yep.
And so that you can hire the part-timer and get the revenue against it.
Yep.
Okay. Any other questions on that? All in favor? Aye.
I,
Lauren, is that why our good lieutenant is there?
Yeah, just in case there was any questions, but
Oh,
Thank you, Lieutenant.
no questions.
Thank you.
I thought it was the rowdy crowd. I was sure.
You did
Okay.
a great job out there. Great job.
and the 6 months is an evaluatory process.
Yes.
So it wasn't budget based.
Right. I mean, I think the plan is to sort of look at it and see, between now and the end of the year, which is about 6 months by the time you get somebody in there, is to look at the amount of work and the need, and kind of keep track of that. The following year to see if is a part-time person, does that meet the need, or is there additional work? Or
Right.
just kind of to see what, we didn't want to start with a full-time person and not know how much work there would be. I think there probably is enough of that, but just to evaluate for the 6 months.
That dollar amount will just get you through to December 31st, and then you'll have to
Yes,
budget for it.
right.
or the, you know,
If there
sheriff
is
or however
full
we work that
part,
out.
right.
Yep.
Okay, HH6 is to pre-fill, which always sounds like medication to me, but you want to fill the senior clerk that you're creating
Right, so,
prior to the individual, if possible, coming off payroll. But at this point, you're going to create a senior typist, so they're all the same.
So, yeah, so we have a person who really unexpectedly decided to retire based on some things that she had going on in her personal life. And that was a typist position, the only typist position left in the front office. So we'd like to create a senior clerk so that all their titles are the same in the front office staff, as they all do the same duties instead of the typist. And her last day of official work will be at the 29th this month. So to be able to put this through now so that we don't waste any more time, as we're already down a staff in the front office.
So create a new position at senior clerk and abolish the typist once the person has retired.
Correct. And she's not returning to work at all. So this
Right.
whole entire time she will be down a person in there.
Can I get a motion for that?
Yeah, move it.
Second. Any further questions about that? Okay, all in favor?
Aye.
You have anything you want to add to?
Yeah, just to, I have some clinic updates on there. Continued to see a rise in people coming in for services. You know, I just kind of listed kind of all the social workers that we have and what the caseloads are looking like right now, which they're anywhere between 90 and 100 for any given therapist at this point, which is higher than we would like them to be at. We have one vacancy. We had somebody who accepted the position and then retracted that and took a different position somewhere else. So we're now recruiting for that full-time person. The hope is that can alleviate some of those caseloads. But at the same time, every time I say that, we just get more and more people coming into mental health, and it doesn't necessarily make a huge difference, but we're hoping that it does. We are, mobile crisis, as you know, has started. My plan is to do an article in the newspaper to put it out to the community, how to access mobile crisis. And now that we've sort of worked out all the kinks, kind of opening up that wider. So it's been successful so far. I was just saying, I think I only know of maybe one person that went to the hospital, all the calls that we've gotten so far. So we're going to keep data on that, and I'll be able to, you know, report out more details about that to all of you as well, once we get a good amount of time under its belt.
The person's been busy though? during
Yeah,
the
so we
day?
have three therapists that rotate through there, so
Uh-huh.
they're partly in the clinic and
Yeah.
partly rotating through there. Yeah, and they've been busy. I mean, it's sort of one of those things, it's like unpredictable about the workload, but we've been flowing crisis calls to the team, so that's billable time as well, but then they can decide whether it's, you know, hey, it's turned into a mobile crisis or what. So they're sort of managing some of those calls as well into the clinic.
Oh, so the assessment call is really, it's a billable
Yes,
service because
it
it's crisis.
Yes, it is.
And then
And
it-
we're already able to bill for crisis through the clinic. Yeah.
Yeah.
Yep.
Great.
So I talked about it a while
Oh,
back.
Dave, I'm sorry, Dave.
No, that's all right.
Oh, yeah.
You can finish first.
Oh, go ahead.
All right, two questions. Well, one comment. Thank you for working with Brian at the Sheriff's Department. You guys have a great relationship, and it's been needed for you. So thank you for that. Second one is, with all this increase in people for services, is there a lot more youth than there used to be?
I believe that there is. I think we ran some numbers on that, and I think it was on my report like maybe a few months ago.
Okay,
But yeah, I would say over the years, yes, we have seen an increase in youth.
quite a bit.
Yes, yes.
Yeah. Okay, that's what I think. Thank you.
DBT in schools, so I talked about, we received a small grant for the Department of Justice. And it's really focused on rural communities. So we have MOUs with some of the school districts around providing this training. So we've already done the administrative part of the training. And now we're looking to schedule the training for the teachers, which will be teaching these skills as a universal approach in their schools. So that's going to happen in the middle of July. So we're just looking to finalize some of that training, and hopefully the implementation can start come the following school year. So again, that's a universal approach that would be provided to all students. That's really about teaching. It's a preventative approach to mental health. Like if we can give them the skills, everyone the skills, hopefully it could cut down on some things.
And you're teaching the teacher?
So it's taught by school staff.
Okay.
So it's not a clinician. Well, I should say all schools can do it very differently. So it could be taught by a social worker and a teacher, or it can be taught in core classes, can be taught in the health class. School districts do it all differently of what they can fit into their curriculum and what works for them. So it really could be any of those school staff being
Yes.
trained.
Like emotional regulation.
So there's emotion regulation skills, interpersonal effectiveness skills, mindfulness, distress tolerance skills, and then there's some dialectical strategies that are taught as well. So learning how to think differently and hold the conflict evenly. Yeah.
We should do it here.
Everyone should. I really feel like everyone can benefit from it. So yes, I would agree.
Lauren, did all of the rural school districts sign on?
Not all of them. We're looking to confirm up. There was some new interest even after we did the administrative session. So it's really any of the school districts can, we have enough spots in the training for any of the school districts to be trained. We heard back from, majority of them, but no, I would say not all of them. Either that's for a couple reasons. One, they could already have a universal kind of curriculum that they just started or they were working on anyway. So maybe that's the reason for not, or I'm not sure what the other reasons would be, but it's free. We're providing the training for them, so they don't have any cost. So. Just that's it, other than the work at the jail that we've been working on with the mental health at the jail.
Thanks a lot.
Brenda? We can start with HH7, what they providing meals to the Elder Choice Day program.
So this is a contract that we've had right along, and it just it's time to update it.
I'll move it.
Second, Lydia.
Any other questions? All right, all in favor?
Aye.
Okay, and this is probably a resolution you've had also that,
Yeah, and this one, the service shut down during COVID, and now we've been able to restart service with them. So that's why we're redoing the contract now.
Move it, Lydia.
I can second it. I'll second it. Any questions about that? All in favor?
Aye.
All right. And then lastly, you have authorizing the chair and the director of OFA to sign annual contracts with various subcontractors. Some of these were in the beginning of the year, but then some rates got upped. Is that kind of why it's
It's actually routine. We do
Okay.
federal year
Okay,
contracts and
okay.
then we do state year contracts. So these are all the state year.
okay? Gotcha. All right. So these are similar organizations you're doing business with, just the rates.
I think they all are. Yeah,
Yes. Okay.
pretty much.
Can I get a motion for HH9?
Yeah, move it.
Second. All right. All in favor?
Aye.
Great. Do you want to give some information other than what you put on your report? What you didn't.
The report has been pretty busy. We're still haven't had any applications whatsoever for our fiscal position. So we still have a temporary person helping 2 days a week. And it's getting interesting. So that's all I can say. So, but I do want to thank all of you for recognizing at the meeting, I wasn't able to attend, but recognizing our senior citizens. That was such a nice thing. I was able to watch it. We always really appreciate that. And, they're always such wonderful people. I do want to mention too that we have our volunteer picnic scheduled for June 27th. I know a couple of folks are able to attend that, so that'll be nice. We will be submitting a proclamation for that. We'll probably just read that at the event. So I thought I would just share with you really quickly. The proclamation talks about our meal delivery miles every single day. The drivers drive 503 miles. So that's 125,000, almost 126,000 miles every year that our home delivery meal drivers drive. So those are all volunteers. And if we had to pay them minimum wage, which at this point, we can't hire anybody at minimum wage, but if we were paying them minimum wage, that would be about 120,000 a year to pay all those folks for the hours they put in. And we really are pretty conservative when we look at how many hours they're putting in. So the total hours or the total value to the county, to the community for those volunteers is close to 130,000 a year, estimated very conservatively. So not only do they make a really big difference for those individuals that they go out and see, they are an absolute asset and value to our county. So I wanted to share that.
Those are the people we'll be celebrating at this picnic.
Right. Yep. And farmers market coupons start, as Kathleen said, for us, the distribution starts July 17th is our planned distribution. We have multiple distributions throughout the county. However, the state last year did decrease the amount of coupons that they make available to us. And I know I keep telling you there's more and more seniors all the time. So that's a little bit of a problem. We're hoping to be able to distribute coupons to all the planned distributions, but we purposely changed it up a little bit this year. So we went Auburn, north, south, Auburn, I think north, south, I don't remember exactly, but we really tried to make a point of if we run out at the end, we've at least been in that area that we had planned to go to again. We've been there at least once. We're just trying to make it as equitable as we can. But we do anticipate running out this year completely. So that's all I have.
I have a question for you. How long have you been without your fiscal employee?
It feels like forever.
I was
It
gonna
was
say, it does feel
December
like forever.
23rd. And of course, part of the reason it feels like forever is end of fiscal year, new year, end of state fiscal year. We're just now, because it's been 6 months. We're 6 months. So the essential kinds of things of paying the bills, paying the staff, getting some claims in is getting done. There's just so much more that this position did. I mean, we get about $100,000 in donations from individuals. This person would track that and we do thank yous to all those folks. We have some legal services this person was tracking. We have so much state detailed reporting. So what our temporary person is just finding out is once you've paid all the bills and done the claims, we have an annual plan that we have to say to the state what we're going to do with all the dollars that we get from all our different grants. And then if we do that differently somehow, we spend less, we spend more, however that ends up working out, we spend more on staff, less on services, or vice versa. We have to go back to our plan that we submitted and update all that information. It's a real headache. And so she's just getting into that. We've had numerous calls with the state fiscal department at NYSOFA trying to get some assistance. They also are short staffed and have new people. So that's a challenge. And we have we're 6 months behind on our, what they call our CARS report, which is once we paid the bills and reported what we've done as far as changing our plan, then we have to go back and compile our data of people served and put the financial data in as well. Just another layer that's been required forever from the state, from NYSOFA. So that's at least 6 months behind at this point. We've got all our contracts that we do. It just goes on and on.
I'm sure you've been in touch with HR to see if there's any new strategies or new places to advertise.
It was on Indeed. Last time I talked with HR, they were going to put it in the paper. I've put it in the paper in the past. We've had it on Facebook. We don't really have anybody to do any nice graphics kinds of things to put anything fancy out there. So we just kind of put the basics out. Yeah, I was surprised that we didn't get anything through Indeed.
Has Kelly King done anything to help with the efforts at CareerWorks?
I know that it's posted, that it's posted through CareerWorks. I don't know what the solution is.
Kind of related to that, and I'm not trying to talk where, but we still have our junior accountant position vacant, and we have paid to have also the placement, the places that Brenda spoke of, but also, Syracuse.com, Handshake, which is the college websites for recent graduates. I can't remember the
Has
other
it
one.
gotten any interest?
We've gotten 0 bites and we've been trying for a number of months. And we do have people who put pretty flyers together, right? And we put, and you'll see them on our TV. And if we had gotten a bite, we would share it with you also if we had even seen something, right? But, and we've been in conversation with the finance department who's been looking to fill vacancies too. So we know that, you know, we kind of talk to say, hey, in social, we know that you've got it. in
Yeah,
social
so you have
services,
vacancies too.
The
Yes.
admin
I know.
director.
Yep.
And it is concern, I'll just throw this out there. It's not a concern this moment, but we anticipate retirements in 2024 in our fiscal department. And it's going to be a real hit if we don't start training somebody to follow up.
And the person I have is an experienced county employee in fiscal. And it might be a third of what we need done that's familiar to her. The rest of it is all NYSOFA specific and our agency specific. And I mentioned the donations. We have donations come in about 5 different ways, through gov.pay, through checks, through cash, through it's just a lot.
What is the thing that HR brought forward? That half? Is
We
that
had 3
Yeah.
interviews with half folks. None of them have met the qualifications for the position.
because they were hoping to find for you, but, or that not, but nothing in their own staff coming and just helping get the work cleaned up?
From half?
Yes, they can find, or they can.
We've had 3, we've had 3 temps come in and interview.
No, I meant.
I know, I'm sorry, I'm missing something.
I thought they would try to find you employees to hire,
Mhm.
but they also have their own set of staff that can come in and complete work. They're never gonna work for you, but at least they could complete some of the work. I think they've done that in the finance
Yeah,
department.
they did.
Someone in the health
Yeah.
department from half.
Maybe that's something
They
you
may
can.
not
talk to
ever stay there, but will come
Maybe I
in.
should clarify. They've come in and talked to us and looked at what we need done and said, no, thank you, I can't do that. Not even applying for the job, just half sent them to work for us.
Oh, and they remain their employee.
Yeah.
Half employee.
Correct.
Oh, there's something about the work they don't like.
It's cost accounting using spreadsheets and pivot tables. And so far, nobody has done anything except payables and receivables and just completely much more basic. So they're looking at what
Yeah.
we're asking and saying, I don't do that. I haven't done that. I'm not familiar with what that is. I could maybe, they've all gone back to the agency and told Hop they don't want to do it.
And they're their employees.
Yes.
Yes. But I would thought there would be comparable work in the finance department,
You would think so.
right?
Elaine, just another comment. Brenda, thank you for having Evie come and help you. Evie's just,
It's great.
she's great. I don't know what we'd do without her. She used to work at the sheriff's department. So I want to thank her and I want to thank you and Shereen working together for your fleet
Yes.
to get that straightened out. So
Yeah.
thank you.
Thank you.
Thanks.
Hey, Debbie. Devin. Hello.
Linda.
So just a couple of additions to the summary that I prepared for you all this evening. When the second time our youth advisory board met, we actually came up with the allocations and voted on them, and those allocations are listed below who will be receiving funding for 2023. Because New York State only gave us a 9-month allocation this time because they're switching it to their fiscal year. The board decided to focus on the summer program specifically so we can get those funded. And then once we receive the October allocation, we will look towards more of the Cayuga counseling, more of the year-round programs that aren't summer specifically, but we wanted to get those specific summer programs committed to so they could go ahead and get started on their plans. The resource allocation plan, that's something after we approve all of the applications at the board level, I have to input everything into a state system and answer a lot of questions and do some work on that end, and also submit some different forms with signatures from Chairman Gould and Dave Dempsey, and that came back today, finally approved that. So our resource allocation plan for Cayuga County has been approved by the state for 2023. So that's, everything's done at that point. I'm notifying these organizations that they're good to go, and that I will be setting up times with them to start coming out and monitoring the programs and giving that opportunity to the board members as well. The Governor's Youth Council, we still have the 7 applications and they're currently being judged at our county level. I'm working with the state on getting some judges on, but I understand they haven't reached out, so I'll follow up with that tomorrow because I know they wanted to move 3 of the 7 onto the state level for judging this month. So I'll keep you all updated on that.
Great. We've had no one before, and now we have potentially 7 people that have showed interest. That's great.
It is great.
Yeah, and then they're from the city of Auburn. We also have a student from Union Springs, Moravia, and Jordan Elbridge. So that's nice too, that it's not just city focused, that it is interested out more.
And Deb, can you tell us who was nominated for the chairperson and first chairperson and secretary? Not nominated, but
Yeah, the
chosen.
chairperson is Rob Ryan,
Okay,
and the first chairperson is Alex Patty.
okay.
He's our youth.
Yep.
And the secretary is myself, because apparently that seems to be a position. A secretary position seems to be something nobody really wants to volunteer to do. So I said I would be willing to do that.
Thank you.
Lydia's got a question.
How many open chairs do you still have left for the committee?
2. Well, you had given me a name tonight, and I have one from Cayuga Community College that Kelly had given me as well.
Okay, so those 2 may be filled
Mhm.
if these 2 come.
Yep.
Good. Thank you. Good job.
My last thank yous for tonight.
Okay,
Thank you. You've done a great job since you've taken over, Deb. I mean that. And thank you, Lydia and Heidi, for being on this board. You've done a great job and for standing up. We thank you. And it's great to have fresh blood in there and doing all kinds of new things. So thank you.
You're welcome. Any other questions?
could you thank Aileen and I for coming? Could you thank Aileen and I for coming tonight?
You're not the only ones.
It's the only thing.
Yeah.
Brian, thank you for being on too.
All right, no other business? Can a motion to adjourn? Second. All in favor?
Thank you.